Right now, somewhere in the world, a stroke is happening. Not every hour, not every few minutes, more often than you think. And for 1 in 7 of those people, the first warning sign isn't dramatic. It's subtle. It's walking across a flat surface and drifting to one side. It's losing your balance in your own kitchen. It's stumbling when there's nothing to stumble over. If you've felt unsteady on your feet, if you've veered sideways crossing a parking lot, if you've grabbed a wall when you didn't think you needed to, your brain might be trying to tell you something critical, something you cannot afford to ignore. I'm Dr. Alistair Pembroke, and you're watching Dr. Alistair Pembroke. If you want health information explained in plain language, with no drama and no sugarcoating, hit that subscribe button and turn on notifications. Balance problems and unsteady walking can signal many different conditions, some mild, some serious. But when they appear suddenly, especially alongside other symptoms, they can be one of the earliest warnings that you are at risk for stroke. Today, I'm going to explain exactly what your body is communicating when your balance fails, what's happening in your brain, which warning signs require immediate emergency action, and most importantly, what you can do right now to reduce your stroke risk before it's too late. A stroke happens when blood flow to part of your brain is interrupted. Your brain tissue needs constant oxygen and nutrients delivered by blood. When that supply stops, even for minutes, brain cells begin to die. There are 2 main types. An ischemic stroke occurs when a blood vessel is blocked by a clot. A hemorrhagic stroke occurs when a blood vessel ruptures and bleeds into the brain. Approximately 80 to 85% of all strokes are ischemic. The remaining 15 to 20% are hemorrhagic. Both types can be devastating. Both types can be fatal. And crucially, both types can give you warning signs before they happen. One of those warning signs is sudden loss of balance or coordination. This symptom is officially recognized by the American Stroke Association, the CDC, and neurologists worldwide as part of the B-FAST stroke recognition system. The B stands for balance. It's the first letter because it's often the first sign. Balance is not controlled by one single part of your body. It's a complex system. Your inner ear senses head position and movement. Your eyes give you visual reference points. Your muscles and joints send signals about your body's position in space. And your brain, specifically the cerebellum and brainstem at the back of your skull, integrates all of this information and coordinates your movements to keep you upright. When stroke affects these areas, your balance system fails. About 20% of all strokes occur in what doctors call the posterior circulation. This refers to the blood vessels that supply the back of your brain, specifically the cerebellum and brainstem. These structures control balance, coordination, vision, and many unconscious functions like breathing and heart rate. The blood supply to this area comes from 2 vertebral arteries that run up the sides of your neck, enter your skull, and merge into a single basilar artery. This entire system is called the vertebro-basilar circulation. When blood flow through these vessels is blocked or reduced, the result is a posterior circulation stroke, and balance problems are almost universal. In one major study of posterior circulation stroke patients, 95.7% experienced gait ataxia, meaning unsteady, uncoordinated walking. This was true regardless of exactly where in the posterior brain the stroke occurred. Balance disturbance was more common than limb weakness, more common than slurred speech, more common than double vision. It was the signature symptom. Cerebellar strokes are particularly dangerous because they can be missed. Only 2 to 3% of all strokes happen in the cerebellum, about 24,000 people per year in the United States. But these strokes have very high complication rates and cause significant long-term disability. Why are they often missed? Because the symptoms can seem vague. Dizziness, nausea, trouble walking. People dismiss them. They think it's an inner ear infection, vertigo, or just feeling off. By the time they realize it's serious, precious hours have been lost. The key word here is sudden. A gradual decline in balance over months or years can be caused by many things: aging, arthritis, muscle weakness, vision changes, inner ear disorders. Those require medical attention, but they are not stroke. Stroke-related balance loss appears suddenly. You were fine yesterday. You were fine this morning. And then, without warning, you feel unstable. You reach for the wall. You misjudge a step. You sway when you're standing still. This is not normal aging. This is your brain signaling an emergency. What does it feel like? Patients describe it as the ground shifting beneath them, a feeling of being on a boat, the sensation that they're leaning to one side even when they're trying to stand straight. Some people describe it as their legs not responding the way they expect. The commands from their brain aren't arriving properly at their muscles. Biologically, here's what's happening. The cerebellum is your brain's coordination center. It fine-tunes every movement you make, adjusting muscle activity in real time to keep you balanced and moving smoothly. When the cerebellum is deprived of oxygen during a stroke, it stops functioning correctly. The result is ataxia, a lack of muscle coordination. Your brain is sending movement signals, but the timing, force, and direction are all wrong. You become unsteady. You stagger. You lose control. This is not something to wait out. This is not something to see if it improves on its own. If you experience sudden balance loss, you need emergency evaluation immediately. Balance loss rarely appears alone. Posterior circulation strokes often cause additional symptoms because the same blood vessels supply multiple brain structures. The second major warning sign is sudden vision changes. This can be blurred vision, double vision, or loss of vision in one or both eyes. Why does stroke affect vision? The occipital lobes at the very back of your brain process visual information. The basilar artery supplies these areas. When blood flow is interrupted, vision processing is disrupted. You may see double because the muscles controlling your eye movements are no longer coordinated. You may lose peripheral vision on one side. You may experience sudden blurriness that glasses don't fix. The third warning sign is severe dizziness or vertigo. Vertigo is the sensation that you or the room around you is spinning. It's different from lightheadedness. Lightheadedness feels like you might faint. Vertigo feels like the world is rotating. Stroke affecting the brainstem or cerebellum disrupts your vestibular system, the inner ear balance system that tells your brain about head position and movement. When this system malfunctions due to lack of blood flow, you experience intense, disabling vertigo. This is often accompanied by nausea and vomiting. Many people experiencing a cerebellar stroke initially think they have a severe stomach virus because the nausea is so overwhelming. Here is the critical point. If you experience sudden balance loss and sudden vision changes, or sudden balance loss and severe vertigo, you are very likely having a stroke. Do not drive yourself to the hospital. Do not wait to see if it passes. Call 911 immediately. The fourth warning sign is sudden severe headache with no known cause. Stroke-related headaches can feel different from typical headaches. They often come on explosively, reaching maximum intensity within seconds. Patients describe it as the worst headache of their life. This is especially common in hemorrhagic stroke, where bleeding into the brain creates sudden, intense pressure. But even ischemic strokes can cause headache, particularly in the posterior circulation. The pain is often located at the back of the head or neck. It may be accompanied by neck stiffness. Some patients describe it as a sensation of pressure building inside their skull. The fifth warning sign is loss of coordination in your arms and hands. You reach for a cup and your hand overshoots. You try to button your shirt and your fingers won't cooperate. You try to write and your handwriting becomes illegible. This is called limb ataxia, and it occurs when the cerebellum can no longer fine-tune arm and hand movements. In a posterior circulation stroke, you may notice that coordination problems are worse on one side of your body. Unlike other types of stroke, where the affected side is opposite the damaged brain area, cerebellar strokes often cause symptoms on the same side as the lesion. If the left side of your cerebellum is damaged, your left arm and left leg become uncoordinated. The pattern matters. Sudden balance loss plus coordination loss plus headache is a medical emergency. These are not isolated symptoms. They are connected. They are your brain's emergency broadcast system telling you that blood flow has been disrupted. Every minute counts. When you have a stroke, time is brain. That's not a metaphor, it's a literal medical fact. Every minute that passes without treatment, approximately 1.9 million brain cells die. Every hour, you lose as many neurons as you would in 3.6 years of normal aging. The most effective stroke treatments can only be administered within a specific time window. For ischemic strokes, the clot-busting drug TPA can be given within 4.5 hours of symptom onset. Some patients may benefit from treatment up to 24 hours after stroke, but the earlier treatment begins, the better the outcome. For every 15-minute delay in treatment, the chance of a good recovery decreases. This is why recognizing symptoms immediately is critical. If you call 911 the moment you notice sudden balance loss, sudden vision changes, or sudden severe headache, paramedics can begin assessment in the ambulance. When you arrive at the hospital, the stroke team is already waiting. Brain imaging is performed immediately. If you're within the treatment window and you're a candidate for TPA, it can be started right away. Compare that to waiting to see if symptoms improve, waiting until morning to call your doctor, driving yourself to the hospital. By the time you're evaluated, the window may have closed. Treatments that could have saved your brain function are no longer available. The stroke has already caused permanent damage. Posterior circulation strokes are particularly time-sensitive because they can cause brainstem compression and swelling, which can be life-threatening. Early intervention can prevent these complications. Delayed treatment often leads to worse outcomes, longer hospital stays, greater disability, and higher risk of death. Let me be very clear about what causes strokes. The biggest risk factor, present in up to 90% of all stroke patients, is high blood pressure. Hypertension damages your blood vessels over time. It makes artery walls thick, stiff, and narrow. This process, called atherosclerosis, creates the perfect conditions for clots to form and for vessels to rupture. It is estimated that up to 40% of all strokes could be prevented with good blood pressure control alone. The second major risk factor is diabetes. If you have had diabetes for more than 10 years, your stroke risk is tripled. Diabetes damages blood vessels throughout your body, including the brain. High blood sugar levels promote inflammation, increase clotting risk, and accelerate atherosclerosis. People with diabetes also tend to have high blood pressure, high cholesterol, and obesity, all of which multiply stroke risk. The third major risk factor is smoking. Tobacco use directly damages your blood vessels, increases blood pressure, reduces oxygen in your blood, and promotes clot formation. Smoking doubles your stroke risk. Quitting smoking is one of the most effective stroke prevention measures you can take. High cholesterol is the fourth major risk factor. Cholesterol deposits build up inside artery walls, forming plaques that narrow blood vessels and increase the risk of blockages. These plaques can also rupture, triggering clot formation that leads to stroke. Obesity, physical inactivity, excessive alcohol consumption, and atrial fibrillation are additional major risk factors. The critical point is this: stroke is not random. It is the end result of years of accumulated vascular damage driven by controllable risk factors. Here's what most people don't understand. Risk factors don't just add up. They multiply. If you have high blood pressure alone, your stroke risk is elevated. If you have diabetes alone, your stroke risk is elevated. But if you have both high blood pressure and diabetes, your stroke risk doesn't double. It quadruples or more. A major study from Finland followed nearly 50,000 people and measured stroke risk based on combinations of hypertension and diabetes. People with stage 2 hypertension, meaning blood pressure 160/95 or higher, had about double the stroke risk. People with diabetes had 2.5 times the risk. But people with both diabetes and stage 2 hypertension had more than 4 times the stroke risk. For stroke-related death, the combination raised risk more than 8-fold. This multiplicative effect happens because each risk factor damages your vascular system in overlapping ways. Hypertension causes mechanical stress on vessel walls. Diabetes causes chemical damage from high blood sugar and inflammation. High cholesterol deposits plaque. Smoking reduces oxygen delivery and promotes clotting. When you combine these, the damage accelerates exponentially. The vertebrobasilar circulation, the blood vessels supplying the cerebellum and brainstem, is particularly vulnerable to this kind of damage. These are smaller vessels with complex anatomy. They're prone to atherosclerosis, especially in people with multiple risk factors. Studies show that patients with vertebrobasilar artery stenosis, meaning narrowing of 50% or more, have extremely high stroke recurrence rates, particularly if they have diabetes and hypertension combined. This is why your doctor checks multiple risk factors at every visit. It's because controlling each individual risk factor has a compounding protective effect. Lower your blood pressure and you reduce risk. Add diabetes control and you reduce it further. Add cholesterol management, smoking cessation, weight loss, and exercise, and your stroke risk can drop dramatically. If you are experiencing sudden loss of balance, sudden vision changes, sudden severe headache, sudden dizziness, or sudden trouble walking right now, stop reading and call 911. Do not wait. Do not drive yourself. Do not ask someone to drive you. Call 911 and tell them you think you're having a stroke. Time of symptom onset is critical information. The emergency team will ask when you first notice symptoms. Be as specific as possible. This determines which treatments you're eligible for. If you wake up with symptoms and don't know when they started, tell them that too. It changes the treatment approach, but doesn't eliminate options. While waiting for the ambulance, sit down in a safe place. Do not eat or drink anything. If you're with someone, have them stay with you and note any changes in your symptoms. If your symptoms suddenly worsen, if you lose consciousness, if you have trouble breathing, have them tell the 911 dispatcher immediately. Do not take aspirin unless a medical professional tells you to. Some strokes are caused by bleeding, and aspirin makes bleeding worse. You need brain imaging first to determine stroke type before any medication is given. What if your symptoms go away? This is critically important. If you have stroke symptoms that resolve within minutes or hours, you may have had a transient ischemic attack, called a TIA or mini-stroke. TIAs have the same symptoms as strokes, but they're temporary. Blood flow is briefly blocked and then restored before permanent damage occurs. Do not ignore a TIA. About 15% of strokes are preceded by a TIA. After a TIA, your risk of having a full stroke is highest in the first few days to weeks. A TIA is a medical emergency. Even if you feel completely fine again, call 911 or go to the emergency room immediately. You need imaging, you need evaluation, and you need treatment to prevent the next event, which may not be temporary. If you have stroke risk factors or you've experienced unexplained balance problems, there are 3 essential tests you should discuss with your doctor. These tests assess your stroke risk and can detect problems before a stroke happens. Test 1. Blood pressure monitoring, both in clinic and at home. A single high reading doesn't diagnose hypertension. You need multiple readings over time. Normal blood pressure is less than 120/80. Elevated is 120 to 129 over less than 80. Stage 1 hypertension is 130 to 139 over 80 to 89. Stage 2 hypertension is 140/90 or higher. Many people have what's called white coat hypertension, where readings are high at the doctor's office but normal at home due to anxiety. Home monitoring gives a more accurate picture. If your readings are consistently elevated, treatment is essential for stroke prevention. Test 2. Hemoglobin A1C for diabetes screening. This blood test measures your average blood sugar level over the past 2 to 3 months. Normal is below 5.7%. Pre-diabetes is 5.7 to 6.4%. Diabetes is 6.5% or higher. If you have pre-diabetes, lifestyle changes and sometimes medication can prevent progression to diabetes and significantly reduce stroke risk. If you have diabetes, keeping your A1C below 7%, ideally below 6.5%, reduces your stroke risk. Test 3. Lipid panel for cholesterol assessment. This measures total cholesterol, LDL cholesterol, the bad kind, HDL cholesterol, the good kind, and triglycerides. High LDL cholesterol directly contributes to atherosclerosis and stroke. Your doctor will calculate your cardiovascular risk score based on cholesterol levels, blood pressure, age, smoking status, and diabetes. This determines whether you need cholesterol-lowering medication like a statin to reduce stroke risk. Additional tests may include carotid ultrasound to check for narrowing in the neck arteries, echocardiogram to assess heart function, and ECG to detect atrial fibrillation. Ask your doctor which tests are appropriate for your specific risk profile. 80% of strokes are preventable. Let me repeat that. 8 out of 10 strokes can be prevented by controlling modifiable risk factors. Here's what actually works based on large-scale medical research. First, control your blood pressure. If you have hypertension, treatment with medication and lifestyle changes can prevent up to 40% of all strokes. Target blood pressure is below 130/80 for most people. If you have diabetes or kidney disease, targets may be even lower. Reducing systolic pressure by just 10 points significantly lowers stroke risk. Medications like ACE inhibitors, ARBs, calcium channel blockers, and diuretics are proven effective. Don't skip doses. Take medication exactly as prescribed. Second, manage diabetes aggressively. Tight blood sugar control prevents vascular damage. Target hemoglobin A1C below 7%, ideally below 6.5%. This requires diet modification, regular exercise, medication adherence, and frequent monitoring. The UK prospective diabetes study showed that reducing systolic blood pressure by 10 points in diabetic patients reduced stroke incidence by 40%. Blood pressure control in diabetes is just as important as blood sugar control. Third, stop smoking completely. Smoking cessation reduces stroke risk almost immediately. Within 1 year of quitting, your stroke risk drops significantly. Within 5 years, it approaches that of never smokers. There is no safe level of smoking. Even light smoking increases stroke risk. Use nicotine replacement, prescription medications, counseling, whatever it takes. Quitting smoking is one of the most powerful stroke prevention actions you can take. Fourth, maintain a healthy weight and exercise regularly. Obesity increases stroke risk by raising blood pressure, promoting diabetes, and worsening cholesterol levels. Even modest weight loss, 5 to 10% of body weight, improves all these risk factors. Regular physical activity, at least 150 minutes of moderate exercise per week, independently reduces stroke risk by improving cardiovascular health, lowering blood pressure, and reducing inflammation. Stroke risk is not constant throughout life. It changes dramatically with age. The chance of having a stroke approximately doubles every 10 years after age 55. By age 75, stroke risk is substantially higher than at age 55. By age 85, it's higher still. This is partly due to accumulated vascular damage over time and partly due to age-related changes in blood vessels and blood clotting. But here's a critical fact many people don't know. Stroke is not just an old person's disease. About 1 in 7 strokes occurs in people aged 15 to 49. Young stroke is increasing, and the primary reason is the rising prevalence of obesity, high blood pressure, and diabetes in younger populations. Conditions that used to appear in middle age are now appearing in people in their 20s and 30s, and stroke risk follows. Women face unique stroke risk factors. Pregnancy, especially complicated by preeclampsia or gestational diabetes, increases stroke risk both during pregnancy and later in life. Oral contraceptive use, particularly combined with smoking, raises stroke risk. Migraine with aura is associated with increased stroke risk in younger women. Hormone replacement therapy after menopause may increase stroke risk depending on timing and type of hormones used. For men, stroke risk is about twice as high as women until around age 75, when the gap narrows. Men tend to have strokes earlier in life. Women tend to have more severe strokes and worse outcomes, partly because they tend to be older when stroke occurs. Race and ethnicity also matter. Black Americans have nearly 2.4 times the stroke incidence compared to white Americans, largely due to higher rates of hypertension and diabetes. Hispanic Americans, particularly those of Caribbean descent, also have higher stroke rates. Genetic factors play a role, but social determinants of health, access to care, and chronic disease management are equally important. The message here is simple. Stroke risk assessment and prevention should begin in young adulthood, not at retirement age. Know your blood pressure. Know your blood sugar. The earlier you identify and control risk factors, the more years of brain health you preserve. Large-scale research has definitively established the link between balance problems and stroke, particularly in the posterior circulation. A study analyzing patients with isolated cerebellar stroke found that in the acute phase, patients showed mild to severe ataxia, with worse performance in those who had larger stroke volumes. Gait ataxia was almost universal. After 3 months, mild ataxia in lower limbs and gait persisted in many patients, particularly affecting gait speed. This tells us that even after recovery, cerebellar strokes leave lasting effects on balance and coordination. Another major finding is that posterior circulation strokes are often misdiagnosed initially. One study found that cerebellar strokes are frequently mistaken for inner ear disorders, viral infections, or migraines because the symptoms, dizziness, nausea, headache, seem nonspecific. This delay in diagnosis leads to delayed treatment and worse outcomes. Medical professionals are now trained to have a much lower threshold for stroke workup when patients present with sudden balance problems, especially if other risk factors are present. Research on rehabilitation shows that recovery is possible, but requires intensive early,